Hello everyone, my name is Jean Ponseni Burengwi from Revosri Biomedical Ines Campus. Uh, we are going to have a conversation with you about applied immunology. We are going to share with you about the curiosity question in applied immunology. The, the first question says that how does central tolerance prevent autoimmunity? By definition, central tolerance is a mechanism occurring in the thymus and bone marrow that eliminates self-reactive lymphocytes during their development. Here, there are some mechanisms of this central tolerance autoimmunity. First one is positive selection. By here, T cell that recognize self major histocompatibility complex survive. The second is negative selection. Self-reactive T and B cells undergo apoptosis if they strongly bind self-antigens. The third one is A protein. The autoimmune regulator gene promote the expression of self-antigens in the thymus for proper negative selection. As the outcome here prevent the escape of autoreactive lymphocyte that would lead to autoimmunity. Uh, You have to understand also what autoimmunity is by definition. Autoimmunity, this is the condition in which the immune system mistakenly targets and attacks the body's own cells, tissues, or organs as if they were foreign invaders. Here we are going to have or to see 12 medical important autoimmune disease, their causes and clinical manifestations. First disease is systemic lupus erythematosus. This is the condition or disease which is caused by autoantibodies against nuclear components as well as DNA and histones. Its clinical manifestations are fatigue, rash, artist kidney damage, or simply glomerulonephritis and photosensitivity. The second disease is rheumatoid arthritis. This is caused by autoantibodies, which is rheumatoid factor anti-CCP targeting drawing proteins. Its clinical manifestation is joint pain, swelling, stiffness, deformities, systemic inflammation. The third disease or condition is multiple sclerosis. This is caused by autoimmunity against myelin sheath in the central nervous system. Its clinical manifestation is muscle weakness, vision problems, coordination issues, and numbness. The fourth one is type 1 diabetes mellitus. It is caused by autoimmune destruction of pancreas B cells. Its clinical manifestation is hyperglycemia, weight loss, excessive taste, frequent urination, etc. The fifth condition or disease is Hashimoto's thyroiditis. This is caused by autoantibodies against thyroid proteins. For example, like TPO and thyroglobulin. Its clinical manifestation is hypothyroidism, weight gain, fatigue, cold intolerance. The, the next disease is Graves' disease. This is caused by autoantibodies by stimulating the TSH receptor. Its clinical manifestation is hyperthyroidism, weight loss, tremors, and exophthalmos. The seventh disease is psoriasis. This is caused by autoimmune attack on keratinocyte cell. Its clinical manifestation is scaly skin, plaques, redness, and itching. The last disease is celiac disease. This is caused by autoimmune response to gluten damaging the small intestine. Its clinical manifestation is diarrhea, weight loss, malabsorption, and abdominal pain. Other disease is inflammatory bowel disease or IBD. This is caused by autoimmune attack on the gastrointestinal tract. It is said to be Crohn's disease or ulcerative colitis. Its clinical manifestation is abdominal pain, diarrhea, bloody stools, and weight loss. The tenth disease is Sjogren's syndrome. This is caused by autoimmunity against the salivary and lacriminal glands. Its clinical manifestation is dry eyes, dry mouth, difficult swallowing. The next disease is ankylosing spondylitis. This is caused by autoimmune inflammation of the spine and sacroiliac joints. Its clinical manifestation is chronic back pain, stiffness, reduced spinal mobility. The last disease is autoimmune hemolytic anemia. This is caused by autoantibodies against red blood cells. Its clinical manifestation is fatigue, pallor, jaundice, shortness of breath. Let me move on the seventh question, which is say that what are the immune checkpoints and why are they important? By definition, immune checkpoints are inhibitory molecules on immune cells that regulate their activity to prevent overactivation and maintain self-tolerance. Here are some examples of immune checkpoints. For example, like CTLA4 and PD1 or PDL1. Yeah. For the first example, called CTLA4, this inhibits T cell activation by competing with CD28 for binding to B7 molecules on antigen-presenting cells, shortly APCs. On the second example, which is PD1 or PDL1, this suppresses T cell activity when PD1 binds its ligand PDL1 on tumor or normal cells. Here are some importances of this immune checkpoints. The first one is prevention of autoimmunity. But here immune checkpoints limits unnecessary or prolonged immune responses. The second policy is tissue protection. By here, reduce collateral tissue damage during infections or inflammations. The third importance is the cancer therapy. But here, tumors exploit immune checkpoints. For example, like PDL1 expression to evade immune detection. Checkpoint inhibitors, for example, like anti-PD-1 or PDL1 drugs, are used in immunotherapy. Next question say that how do cytokines regulate immune responses? Firstly, we have to understand what cytokines is. By definition, cytokines are small signaling proteins that mediate communication between immune cells and regulate immunity, inflammation, and hematopoiesis. Here are some regression mechanisms. Firstly, promoting immune activation. By here, interleukin 2 stimulates T cell proliferation, and interferons activate macrophages and promote Th1 responses. Secondly, enhancing inflammations. Here, interleukin 1 and interleukin 6 promote fever, recruit immune cells to infection sites, and stimulate acute phase protein production. Thirdly, inhibiting immune responses. By here, interleukin 10 and suppresses immune activation, promote trigger development, and control inflammation. The fourth one, directing immune pathways. Interleukin-4 derives the Th2 responses and promotes B-cell activation and antibody production. Interleukin-12 also promotes Th1 differentiation and activates natural killer cells. Fifth one, recruiting immune cells. Chemokines attract neutrophils, monocytes, and lymphocytes to the site of infection, stimulating hematopoiesis. For here, GM-CSF promoted the production of granulocytes and macrophage. 7. Free antiviral responses. Type 1 interferon inhibits viral replication and enhances the killing of infected cells. Next, cytokine storms. Dysregulated cytokine release, for example, like during sepsis or COVID-19. This leads to excess inflammation, tissue damage, and organ failure. The next question which is saying that how do monoclonal antibodies work in immunotherapy? By here, firstly, you have to understand what monoclonal antibodies it is. By definition, monoclonal antibodies are laboratory-made molecules designed to mimic the immune system's ability to fight off harmful pathogens, including cancer cells. Here there are some mechanisms of the actions. Firstly, targeted binding. But here monoclonal antibodies bind specifically to antigens on the surface of cancer cells or pathogens. For example, CD20 on B cell in lymphoma or HER2 in breast cancer. The second mechanism is direct destruction. By here, antibody-dependent cellular cytotoxicity, shortly ADCC. The antibody binds to the target cell, recruiting immune cells, for example, like natural killer cells, to kill the target. Also, complement-dependent cytotoxicity. But here, monoclonal antibodies trigger the complement cascade, leading to cell lysis. The third mechanism is blocking receptors. But here, monoclonal antibodies can block signaling pathways. For example, like anti-PD-1 or PD-81 antibodies to prevent immune evasion by tumors. Fourthly, delivering cytotoxic agents. Some monoclonal antibodies are conjugated with cytotoxic drugs, radiation, or toxins, directly delivering lethal doses to the target cells. Lastly is enhancing immune responses. Monoclonal antibodies may stimulate the immune system to recognize and attack cancer cells or pathogens more effectively. The last question, or the 10th one, asked what is the principle behind the checkpoint inhibitor therapy? As we have seen in the previous question, we have seen what checkpoint mean. But for here, we are going to see, just to share you some understanding about checkpoint inhibitors. By definitions, checkpoint inhibitors are a form of immunotherapy that block immune checkpoint proteins, which tumors often use to evade detection by the immune system. Here, there are some mechanisms for these checkpoint inhibitors. Firstly, immune checkpoint. But here, checkpoints like PD-1 or PD-L1 and CTLA-4 are normal regulatory mechanisms that prevent overactivation of the immune system and protect tissues from autoimmunity. Secondly, tumor evasions. Cancer cells often exploit these checkpoints to prevent T cells from attacking them. For example, PD-L1 on tumor cell binds PD-1 on T cell, this inhibiting immune responses. Thirdly is inhibition of checkpoints. But here, checkpoint inhibitors, for example, like anti-PD-1 or anti-CTLA-4 block these inhibitory signals, allowing T cells to attack and destroy cancer cells. Here are some key therapeutic agents like pembrolizumab or Keytruda. This for here anti-PD-1 used in melanoma and lung cancer. The secondary is novoramab or Opdivo. For here anti-PD-1 used in non-small cell lungs. Uh, Lastly is ipilimumab or Yervoy. For here, anti-CTLA-4 used in melanoma. Some outcomes for here restore immune surveillance against cancer. Effective in cancers like melanoma, non-small cell lung cancer, and breast cancer. Just thank you for your kind attention and utmost consideration. Many thanks.